Good morning. Thank you for having me. Our SIM journey took a little bit of an unexpected political turn. President Donald Trump 2 weeks ago declared the opioid epidemic as a national public health emergency. We were addressing the opioid epidemic in Little Falls before we knew what was happening. Last year, 33,000 Americans died of an opioid overdose. It is the #1 reason for accidental deaths in the United States today. Our SIM grant journey starts in Morrison County, Minnesota. We're located in central Minnesota. Morrison County is a rural population of 33,000 people. Little Falls is at the center with a population of 8,500. It is the poorest county in Minnesota. The logging industry brought much business to Little Falls, and settlers made it their home with many physically demanding jobs. So the Franciscan Sisters opened the first hospital, St. Gabriel's, in Little Falls in 1892. So let's speed ahead to 2014, where our #1 reason for emergency room visits is patients seeking narcotics for pain. Emergency room staff is very inundated with volumes of drugs and opioids, and people wanting early refills of these same. So the same was seen in the clinic. Doctors were concerned with the time it spent for patients that were requesting early refills, and what do we need to do about this, and what funding can we have. So welcome SIM grant. Along with that, 30% of our medical assistance population had filled between 8 and 20 opioid prescriptions just in an 8-month period. Our focus would be this target population. We had many partners very willing to address this problem. Probably our most influential would be law enforcement, our one local pharmacy, and Morrison County Social Services, and St. Gabriel's would lead that. Diversion is something we didn't anticipate to the volume it was. A 70-year-old woman was selling her opioid prescriptions every month to supplement Social Security. Law enforcement informed us they didn't want to arrest her, they just wanted it to stop. So we hired a controlled substance care team with grant funding. She is a nurse navigator, a social worker from the county, and then we have our 2 lead physicians, and then we have also a mental health coordinator that was added with expansion funding. So for the first 324 patients completely tapered from opioids, it equals 370,000 doses of opioids no longer being unnecessarily prescribed. Thank you. Our Coburn's Pharmacy kept track when we implemented our program, so the green bar is 2015, and then we go into the yellow bar today at 2017. We reduced prescribing in that one pharmacy by over 25%. So let's celebrate some of these successes. We had a lady that came into our clinic last week after 10 years of being on opioids. She is no longer a zombie sitting in front of her TV. She's doing yoga, and she's active in her children's lives. We did our first congressional briefing in Washington, D.C. in July of 2016. Congressman Nolan noticed that our medical assistance claims were down. Those 370,000 tablets equals $1.3 million in savings to a medical assistance program. We implemented Suboxone in our we implemented medication-assisted treatment with Suboxone in our program, so now our Morrison County Jail allows Suboxone to be used to treat heroin addiction. In the past legislature, this last session, we passed a bill for over $1 million, not only to sustain our program, but to help those in other communities pilot and replicate our model of care in other programs. Along the way, we won some awards. Here, Dr. Devine and Dr. Bell, our lead physicians, we are accepting the American Hospital Association NOVA Award for Innovative Community Collaborative Care. In September, actually this year, September 28th, Senator Franken invited us to do a second congressional briefing, and we actually did 2 briefings that day, one on the House side, one on the Senate side, to talk about what we're doing as a rural approach to treat the opioid epidemic. The pharmaceutical manufacturers marketed opioids as non-addictive. They only pay $250 for a license every year to do business in Minnesota. This session, the Opioid Family Recovery Act will hopefully change that. While we were in Washington, D.C. last time, eating lunch in a cafe, a young man came up to us. He pulled out his earbud and he said, "Thank you for doing what you're doing. My sister died of a heroin overdose last year, and if there were programs like yours, she could have been saved. So we'll keep doing what we're doing. Thank you."